Hi, my name is Jody Cannon, and I'm a healthcare information security and privacy practitioner for Modern Practice Solutions. And I'm coming here today as we are in the pandemic issue with coronavirus to talk about HIPAA. We actually have to consider that during emergency crisis times as well. So I wanted to give you some few tips because I'm pretty sure that by now most of you are working from home. And so I'm sure that's a good thing at times too when you can work from home. But we also have to consider when we're dealing with protected health information, how we're accessing that information, our softwares and programs as we remote into our networks. So let's think about a remote access policy. So if you have one, please refer to that. If not, we do have the remote access policy as part of your access control policy. For those of you who do not have one, definitely reach out to us. So some tips on that is you may be utilizing a laptop, some form of a notebook or iPad or company issued device to work from home. So we need to most importantly think about the secure network. Please do not Wi-Fi from other networks. Definitely reach out to your IT specialist as they may have already set up a VPN or virtual private network that is secured and requires multi-factor authentication. However, you also may be utilizing a third-party vendor for remoting in. That is fine, but we do have to consider, are they HIPAA compliant? So definitely make sure they are a HIPAA compliant vendor, as well as most importantly, we must obtain that signed business associate agreement as well before utilizing that service. Now, some of those third-party vendors will also have some HIPAA considerations, step by step as to how to utilize that service to be HIPAA compliant. So we want to make sure, most importantly, that it requires multi-factor authentication and it is encrypted when utilizing the software. Do not store passcodes on any of your media devices that you may be utilizing from when working from home, such as storing the passcode to where all you have to do is sign in and that is it. You want to make sure that you're completely logging in and out of those softwares properly and logging back in each time with your ID and passcode each time. Again, that's part of passcode management as well as part of security. Another device that we also need to consider is the mobile device. Some of you by now in emergency situations may be utilizing your mobile device for communications with your patients, co-workers, as well as other specialists and so forth. So we want to make sure that you have your mobile device policy to refer to. If you do not, please reach out to us. Most of all of our annual clients will already have one of these, but if you do not, please let us know. So some tips on mobile devices to think about. Are we having our lock and automatic swipe functions already set on our phones? Make sure those are set. If you are opening files or you are sharing with your coworkers images of the patient schedules and so forth, we need to make sure if you're going to store that information that you encrypt the mobile device. If you are utilizing work email that you may have integrated with your phone, you may want to ensure that if you are sending or communicating with patients or other specialists and you are going to send protected health information, that we must send that in a secure means of method, meaning encrypted email. So definitely think about that as well. You may want to make sure multi-factor authentication is also set in your security administrative settings of your work emails. If you have to send any protected health information, again, we have to stress the importance of encryption. You may also want to check with your IT specialist during this time frame if there's ways or capabilities that can be set where IT specialists can have access into mobile devices and or other media devices to shut down those devices or remove access to softwares and programs and emails in the event that the device is stolen. So definitely think about that additional security as well if we are going to be allowing the use of mobile devices. We also have to think, in addition to cybersecurity, we have to think more on cyber scams. So the Office for Civil Rights has issued a wonderful notice this morning to Bulletin on defending against COVID-19 on cyber scams. So as individuals, the Office for Civil Rights is encouraging us to be vigilant and cautious, and so they're asking us to take precautions when we are utilizing our emails. So avoid, number one, avoid clicking on any links or unsolicited emails, and be wary of those email attachments. Number two, make sure we are utilizing a trusted source, such as a legitimate government website. So if you're looking up information about COVID-19, make sure it's fact-based information as well as current and up-to-date. Please, under no circumstances, number three, do not reveal your personal or financial information in email, and do not respond to email solicitations for this information. Number four, if you are thinking of donating to charitable organizations at this time, please verify it's an authentic website and a confirmed real charity organization. You can review the Federal Trade Commission page on charity scams for more additional information. Now, this bulletin also is available on the Office for Civil Rights website, as well as if you need additional information from us. They have also issued, the Office for Civil Rights has also issued a limited waiver of HIPAA sanctions and penalties when we have a nationwide public health emergency as we do now. So we have sent out mass emails this morning regarding this notice with the attached documentation. They also remind us that we have to still consider the privacy rule and disclosures in emergency situations and when we can and cannot disclose protected health information. So they also provide that in the bulletin that we have shared today in a mass email. If any of you would like a copy of this or do not have this bulletin, please feel free to reach out to us. So again, these are just a few tips to remind you of. Again, that would be the mobile device policy, the access device policy, as well as the bulletins and notices from the Office of Civil Rights. If any of you have any questions at all regarding HIPAA, regarding privacy and security, please feel free to reach out to us. You can reach out to me at jody@oliviawan.com, or you can call us at 931-232-7738. And thanks for joining me with HIPAA Talk.